Hello and good evening and good day. And it's good to be back. And welcome to our Stronger Together event once again. And another special guest is with us already. And this is Dr. Esther Morban. Hi, Dr. Esther. How are you feeling tonight?
Hi, Caroline. I'm really glad to speak with you again.
Yes, it's definitely good to have you back. This is your second webinar with our Stronger Together initiative. The first time was during our Stronger Together first edition. So I'm definitely very happy to have you back, you with us, of course, on our Stronger Together, the second edition. And as always, I'm your host, Caroline. So please let us know that you can hear us, and we'll be more than happy to go ahead with our topic tonight. And before we start, as always, let me just mention that all the Strong Get Together events have been brought to you so we can support you, answer your questions, but also provide you with some insights from top fertility experts like Dr. Esther Morban today. And our main topic tonight in the Stronger Together events is successful IVF treatment after failed attempts. And today, actually, we are going to talk also about the importance of making an exhaustive selection of donors. And we will start off with the presentation that Dr. Assad has prepared for you. And right after that, it will be time for your questions. So, as always, just put them in the chat section. And of course, she will be able to answer them for you. And before we go ahead with the presentation, I just want to thank to our ambassadors and partners. As you can see, there's a bunch of people that is behind us, and it's great to have them on board with us as well. Thank you so much for that. And I guess we can go ahead with the presentation. And let me just mention that Dr. Esther, she is the gynecologist and fertility specialist at Clinica Tambre. So we are connected to Madrid, Spain. So I'm very, very happy to have you back with us, Dr. Esther. And are you ready to start with the presentation on our topic tonight?
Thank you very much, Caroline. So let's start with the topic today.
Perfect. Thank you.
Thank you. So what will be covering today? So we're talking about donor selection, some treatments, and we will talk about also the physical characteristics and ideas to take home. So talking about donors, we will talk about, first of all, of egg donors. So the first selection criteria are the age. So donors should be 30 years old or under. The minimum height is 1.55 meters, and the maximum body mass index is 30. So afterwards, we will do the first visit with the nursing team, in which an anamnesis will be done. We will discard any medical conditions as well as familial diseases. Apart from that, our nursing team will do an explanation of the process, and we will ask and answer all the questions that the donors may have. Afterwards, an interview with the psychologist will be done, including psychological tests, to discard any psychological diseases or conditions. Then some medical tests will be done. So first of all, we will do a general health research in which a complete blood cell count will be included, as well as blood type and other blood tests such as serology. Then the gynecological test will be performed, in which an ultrasound with a count of antral follicles will be done in the consultation, a smear test and vaginal swab to discard an infection in that way. It's important to mention that apart from those general tests, we always perform some genetic ones, including a karyotype and some genetic tests. The most important, because they are the most common ones, is the cystic fibrosis test, X fragile, and some other basic recessive mutation that we always test. Normally, all donors are tested by 33 genetic illnesses, but we can do a wider examination that includes more than 300 genetic diseases that can be studied and can be performed to reduce the genetic risk that the patients may have. Regarding the sperm donors, the selection is almost the same. So the first criteria is the age, so they have to be 35 years old or under. The minimum height is 1 meter 70, 1.70 meters, and the body mass index is 30 as well. So then they would have the first consultation with the andrology team, where the explanation of the process would be done, as well as the anamnesis, where the no medical conditions and familial diseases will be discarded. Then the psychologist will do the examinations to discard any psychological problems, as well that we did in the egg donors ones, and some medical tests will be performed. The general health research is the same as the female donors, and we add, of course, the andrological test, including sperm count and sperm and urine cultures, as well as the PCR for chlamydia. The genetic testing is the same as the donors want. So the selection will be always done by the center in order to respect anonymity. And that selection will be based on different steps that we are going to follow to do the best selection for each patient. So we are going to consider the physical characteristics of the patients, the blood type. We will use a special program called Phenomate that we will mention about that before. Of course, it's important to consider the doctor-patient communication, and in some specific cases, we need to test and to select donors regarding the immunological matching when it's needed. I mean, the CURE-HLA system, in very specific patients, we need to test the donors to be sure that they have that immunological special characteristics that have to be used in that kind of patients. In many patients, we do the genetic matching, in which we are going to study that more than 300 genetic illnesses, and we will put that examinations in common with the patient so that we can reduce the genetic risk to try to reduce in the end the chance of having a baby affected by some specific genetic diseases. So one of the most common treatments is the egg donation one. In that treatment, there are like two different parts. The donor one, that we have mentioned some of the conditions that donors have to follow, and the other is the recipient, which is the patient. So we have mentioned that donors have to be 30 years old or under. Of course, no reproductive problems, and all the psychological, medical, and genetical tests we always perform in our clinic. Donation in Spain is anonymous, and we always, of course, we know the physical characteristics of the donors, and we always take a picture of them to use that pictures in the future with the phenotypes. The donor will do an ovarian stimulation to do an egg retrieval and to retrieve a good number of eggs that will be given to the patient. So the patient would be the one that is going to follow, let's say, like a easier treatment. So we always try to synchronize the patients with the donor. In the end, we try to do both treatment more or less at the same time, so that the patient doesn't need to wait for a long time until the donor performs her stimulation. The patient will do an endometrial preparation to do the embryo transfer. So in the end, the patient will be the pregnant and the real mother. Talking about the IVF treatment with donor sperm, we know that the main indications are the failure of artificial insemination, advanced maternal age, pathology of the fallopian tubes, severe male factor, need for pre-implantational genetic screening, and of course, this is the chance for single mothers or even same-sex couples. So what about the physical characteristics? So in Clinica Tambre, we have many years of experience in donations, treatments with numerous donors. We have more than 2,500 samples stored in our bank, respecting very strict security rules, and we have a wide range of phenotypes. In the end, we don't have any waiting list because we are quite a big center. So we have almost all the physical characteristics in our bank. In the end, the patients will have a greater chance of finding the perfect donor for them, which is our aim in the end. So the first way to select donors is the patients will need to hand in the following document, including the consent form of the treatment. This is a general document in which the patients will tell us their height, weight, and all the important information about them. Then we take a photograph of the patient, or that photograph can be sent to the clinic so that we can have more information and more accurate information to select the best donor for them. So a very specific program that we have been using for like more than 3 years is the Phenomat. So what's Phenomat? Phenomat is a facial matching, which is a scientific tool that uses biometric technology to identify facial point distances. So it allows a very accurate selection of the donor regarding concrete facial features. So what we do is, with the picture of the patient and the picture of the donor, we try to match them and find the most suitable donor for each patient. So using, as I was mentioning before, a single photograph of the patient's face, the algorithm scans more than 12,000 data points in order to find the donor with the greatest biometric similarity to the patient. This means that the donor's conceived children are more likely to look like their parent, which is our aim and which is what we are looking for. So as a result, we always choose the donor that suits you the best and with the higher score in facial features after having done a previous selection of several donors regarding physical characteristics and blood type. So after we use that Phenomat, the patients will receive a report certifying the use of Phenomat during the selection process. So the ideas to take home, that for me are like the most important ones. So we don't talk about good or bad donors. We talk about compatible donors. Therefore, not only the physical characteristics are important, but also the compatibility. Not all the clinics do the same pre-screening of the donors. It's important for the patient to have all the information about it to make the good selection. And thank you very much for your attention.
And thank you indeed for this presentation, for explaining how it works. Thank you also for mentioning what kind of methods you are using as well, like Phenomatch, for example. So huge thanks for that. And well, as you know, now it will be time for our Q&A session. So I do see more and more people are typing, so we will go ahead with your questions. So just let me remind everyone that if you would like to get some more info, just go ahead and type those in. And let's start with the first question that we have received right here as well. What could be the problem if a donor collects blood? Either the egg retrieval, can egg retrieval be done then? During the egg retrieval, I guess.
Yeah, I suppose that maybe, Angela means that if there are any surgical complications during the egg retrieval.
During or before egg retrieval, I guess.
Well, actually, maybe, I would like to clarify that all the tests are done before the donor donates. I mean, so we do all the screening, the psychological, and all the blood tests are done before the donor donates. So in our center, more than, well, I would say that around 2 months is the time we need until the donors do all the tests that we need to perform. Afterwards, the donors start to donate. So once we know that everything is fine and they can donate, they start donating in that moment, not before. So once the donor performs and once we do the egg retrieval, in that moment we know that all the tests are fine, but not before. So if we find out that there are any, specific alterations in the test, that donor won't donate. at least for that moment, unless that alterations disappear, of course.
And thank you so much for explaining that, and of course for the very first question, Angela, as well. And let's have a look at the next one. Can you use your own donor?
I'm afraid in Spain it's not possible because donation is anonymous, which means that the patient won't know who the donor is. So in Spain it's not possible to choose or to, let's say, bring your donor to the clinic because it wouldn't be anonymous in that way.
Of course, thank you for the clarification. So in Spain, only anonymous donation is possible, of course. Thank you. Okay, and let's go to the question from Angela. It's like a follow-up, okay? So here
Mhm.
we have a look at this. I'm asking because there was blood collected just before egg retrieval of one of my donors.
Well, maybe they needed to do any specific tests to the donor, but normally the tests are done before the egg retrieval. I mean, so as I was mentioning before, it's important to know that the donate is like a good donor, and well, they can do the procedure afterwards. Of course, we will do the all the organ stimulation and everything. Okay, so cysteine collected in the abdomen. So yeah, maybe that donor had a complication during the surgery, and well, they have like a complication which is not very likely to happen, but well, we know that when we do a neck retrieval, we're going to do we are going to harm at any point the ovary, and sometimes the amount of blood that can be inside the belly can be like quite high, and it's not very likely to happen, but of course these are risks that donors take when they donate. So sometimes we know that that complication may happen, but they are very uncommon, of course. So we do take care about our donors in Clinica Tambre. We always, apart from, of course, doing the procedure according to the protocols, we always phone our donors after doing the egg retrieval, the day after doing the egg retrieval, and then we always do a vaginal scan in about 1 week after doing the egg retrieval to make sure that everything is fine with them.
Okay, thank you so much again for explaining. And if you can have a look, okay, there's a follow-up again. And another time, my egg donor had blood collect in the abdomen afterward. What would the problem be?
Well, the blood normally comes from the ovaries. So in the end, maybe that donor had, I don't know, it were different donors. Maybe if the ovarian response was quite high, sometimes, of course, the risks the patient is going to take during the egg retrieval will increase. So, well, some donors and even some patients will take that risks. So in the end, as I was mentioning before, this is not a very common, of course, it's common, but it's not very likely a very likely complication to happen because, that procedure is like quite well established and we know how to do it. But when you go to do that kind of surgeries, the risk is there, so it's impossible to avoid it. So it's not very likely to happen, but when it happens, you have to know how to solve it, of course.
And thank you once again, of course, for the follow-ups indeed as well, and for answering that one. And let's have a look at the next question. Two parts of the question, okay?
Mhm.
So can I choose gender of the baby and that the donor is Spanish? Also, do you do phenomatch for both egg donors and sperm donors? And
Mhm.
PS, will the donor will remain anonymous for the baby even after 18
Mhm.
years old?
Okay, so regarding the first question, of course, we use the phenomat for both donors, the egg and the sperm donors. And regarding the choice of the gender, in Spain it's not possible according to the Spanish reproduction law. So it's not possible to choose the gender of the baby. And of course, according to the anonymity of the procedure, it's not possible to choose that and to say that you want a Spanish donor because the selection is not regarding the nationality of the donor, it's regarding the race, hair type, skin color, hair color, and so on. So we consider the physical appearance, not the nationality of the donors, because in the end, the important thing is to find a suitable donor for the patient, not the nationality of the donor.
All right, of course. Thank you so much, And of course, you've answered that one as well.
Mhm.
Let's have a look at the next question right here. I have
Mhm.
two questions about the sperm donor criteria. Is IQ or other measures of intelligence considered? Can you speak more on the mental screening process in Spain? For example, history of
Mhm.
depression?
Okay, so regard the first question, sorry, there is no specific intelligent test that is done by the psychologist. She performs a very personalized interview in which she asks some specific questions about the familial diseases, especially mental diseases such as depression, schizophrenia, and so on, and some background of mental diseases. And then, depending on the donor, she sometimes, well, I would say that always, she performs some specific psychological tests to discard any mental problems. So, in the end, it's a very and quite wide examination in that way that is performed by our psychologists. Not all the centers have a psychologist. In our clinic, we have a psychologist, and she always selects donors in the way of the psychological aspects.
And perfect. Thank you again for answering yet another question. And let's have a look. Of course, more of those are coming up. With 2,500 samples in your bank, what's the percentage of Southeast Asian origins donors do you have?
Well, actually, we have donors from all the different characteristics, but it's true that it depends on the patient we have. I mean, so the most common patient we have is like Caucasian, as I am, but of course, it depends on the patient. So it's very difficult to know exactly the percentage of Southeast Asian donors that we should have, because of course not all the patients are the same. So we prefer to to know the patient, to meet the patient, to know if we have to look if we have a suitable donor for her, to say exactly if she wants to go on with us, if we can use a very specific donor, and if we are able to find someone who looks like her or like him. So in the end, it's very difficult to know exactly the percentage of patients or donors that could be matching with that patient, because we prefer to look and to meet the patient and say, okay, we have a suitable donor for her, or we need to search for someone that looks like you.
And excellent. And well, actually, our two questions that we
Mhm.
have are in regards to this as well. Okay. So you have answered this one. Yeah. Do you have donor from diverse origin? You have
Exactly.
mentioned
Exactly.
that.
Different
Uh,
races, different physical characteristics. Exactly.
Exactly. Perfect. Thank you. And let's have a look at this one then. Okay, it's a bit of a longer question. So my second question is about being of mixed race, Filipino and Caucasian. It seems that if I include my boyfriend, he had vasectomies, and so I'll
Mm-hmm.
be using donor sperm. So if I include him in the process, then I can request a Caucasian donor because he's also Caucasian. However, it is not important to me if his physical characteristics are considered in the donor selection process. Can you comment on whether I need to include him in the
Hmm.
process in order to have a Caucasian donor?
Okay. So actually, according to the Spanish reproduction law, what that law says is that both donors, I mean the sperm and the egg donor, have to look like the mother. I mean, so if the patient is Caucasian, both donors have to be Caucasian. But if, for example, she's from Filipinas and the partner is Caucasian, both donors have to look like the patient. So this is what the law says, and we of course follow the law. So we can't use Caucasian donor unless the patient is Caucasian. So it's important to know that the Spanish reproduction law says that both donors have to be similar to the patient, to the mother, let's say like that. So in that situation, if she's from Filipinas and the partner is Caucasian, both donors should be look like her in the end.
All right, perfect. Thank you so much for that explanation. This can be quite confusing for some patients, definitely,
Yeah,
especially in that kind of case. So, of course,
yeah,
thank you so much
mixed
for
couples. Yeah.
exactly. So, thank you so much for this. Okay. Next question. It's about the age limit. What age do your clinic limit the treatment?
For the patients, I
I
suppose that
believe so.
that Wendy means the patient, so 50 years old is the maximum age.
All right, thank you. And of course, if you have any follow-ups, Wendy, or
Mhm.
just go ahead and type those in. And well, at least for now, it looks like that might be our. We are going to slowly finish, but of course, I just want to encourage anyone if you have more questions in regards to this topic, to our tonight's topic. Go ahead and type those in. And the question is right here. So, my question is if you exchange samples, eggs and sperm, with other banks, hospitals in Europe.
Well, actually, it's not an exchange. So, for example, in Madrid, many public hospitals that need a sperm donor request that sperm donor from our bank because it's the our sperm bank is the was the first sperm bank in Madrid. So actually, we share our samples and our donors with different public hospitals. And in case, we have a request from a different place, of course, we will consider it. But in general, our donors are used even in public hospitals here in Madrid. Yeah.
And wonderful. Thank you so much for this one as well. And there is a thank you from, as you
Welcome.
can see, from Tani. Thank you. Okay. And how do you create the egg donor database? And do you only use your own or collaborate with other clinics?
We have our own egg and sperm banks. So we do not collaborate with other clinics, as I was mentioning before. So our database is based on the physical characteristics of the donor. As I mentioned before, we have pictures of our donors and we have a complete document with information of them. So we have all the tests that were done and we have all the genetic information about the donors, which is something important to consider as well. So we know who our donors are, and we know them perfectly well. So it's a good thing to know, because in other clinics maybe the computer is going to do like the matching between a patient and a donor, but in our clinic, in Clinica Tambre, we it's like a team with different nurses and doctors, the ones that decide what donor could match with the patient, apart from the phenamatch and other selection that we mentioned before. So that's the way how we normally work in Clinica Tambre.
And thanks a million once again for this answer to this question. And let's go to the next question in regards to mixed race, okay, from Vanessa. She would like to ask you one more thing. So the mother is mixed race, half Filipino and half Caucasian. My partner is Caucasian. It would not make sense as a couple if we had children that the child is as dark as me. Anything you can add?
Yeah, the problem is that I perfectly understand her feeling, because I completely agree. But the Spanish reproduction law says that both donors have to look like the mother, and we can't change the law by the moment. So if the law changes in the future, it would be great, because I completely agree that if a couple is mixed, is important to consider it. And if the mother is going to, if the eggs are going to look like the mother, of course the sperm should look like the father. But the Spanish reproduction law is that way, and we can't do nothing to change it, I'm afraid.
That is true. So I
Yeah.
guess we just need
So
to wait for this to
yeah,
be perhaps updated as well.
exactly.
Yeah. Nothing we can do at this point. But thank you so much, of course, because this is definitely something that we should, I guess, speak about as well. Yeah. There are some
Hmm.
things that still are not, let's say, perfect when it comes to law, for sure. Thank you so much for that. Okay. Let's have a look at the next question that we have. Do you grade equality?
Actually, it's not possible to grade the eggs. So most donors are fertile. So it means that the egg quality is high. So, but apart from that, it's not possible to grade the quality of the eggs. So we know that there are mature eggs, which is the ones that are selected to be fertilized, but we don't have, well, actually, because there is no a classification in the egg quality. So the quality of the eggs, we know that is really related to the age. So if we are thinking that donors are 30 years old or under, the quality of the eggs is really high. Apart from that, as I was mentioning before, many donors are fertile, so it means that the egg quality is high also. But we don't have any classification to grade the egg quality in this moment.
Perfectly understandable, of course. Thank you. And there is another question from Wendy, so let me go straight to that.
Mhm.
And do you discuss? So you've mentioned that about equality with the patient.
I mean, is that we know that the eggs are good quality because donors are young and they are fertile in many occasions. So the egg quality is normally really high. So there is no discussion in that way.
Of course, thank you for the clarification once again. And of course, there's a thank you from
Welcome.
Wendy as well, right here. Okay, next question is from Noreen. If you can't find someone with a similar characteristics because
Mhm.
you don't have that many Asian donors, can the recipient make a selection themselves by looking at the donor's pictures?
No, as I was mentioning before, donation is completely anonymous. So it means that it's not possible to see any picture of the donors because it's completely forbidden by law. But what we can do is, for example, if the if the patient has to wait maybe some more weeks to try to find someone who looks like her, it's just a matter of talking with the patient and, well, giving that kind of information in very specific and, I would say, that quite uncommon situations. Sometimes we can try to find a suitable donor in a different egg bank in Spain, or normally in Spain, but in general we don't use that kind of banks because we have a quite wide um, egg bank, so we don't need to use a different bank from ours. So in the end, if it's a matter of waiting for the most suitable donor for the patient, we always inform our patients to let them know that, well, we know that we are going to find a donor, but it will take longer than we expected. So it's just a matter of having a good communication with the patient, and that's all. But it's not possible to see a picture to choose from different donors. It's completely forbidden by law.
And perfectly understandable. Again, thank you for the clarification to this one. And of course, there's a thank you from Noreen.
Welcome.
Okay, sorry, next question is up. So how long does the process take?
Well, if we are talking about the selection of the donor, normally it takes like not more than 1 month. So it will depend on the physical characteristics of the patient and, well, the donor that we need to select. I mean, for example, if we need a very specific HLA donor, I mean, if, for example, we need to test donor regarding the immunological system, sometimes it will take longer because we need to find a really specific donor, and maybe it will take 2 months. It depends on the situation, but normally it won't take more than 1 month. Of course, as I was mentioning before, if the patient has a very specific blood type or physical appearance, it will take longer, but normally not more than 1 month.
Thank you again for that. And do you guarantee a minimum number of eggs and embryos per transfer?
Yeah, actually, we guarantee both of them. Depending on the sperm quality, the sperm quality is normal. We guarantee a number of embryos. So I wouldn't say embryos per transfer. We guarantee number of embryos at the end of the procedure. So we normally transfer one embryo, but if the patient, for example, the patients want, I don't know, to have a guarantee at least, let's say, 2 embryos, we always reach that guarantee. So the idea is that, for example, if the sperm has a really bad quality, in that situation we guarantee number of eggs, but in general we guarantee number of embryos at the end of the treatment to our patients. Exactly.
And amazing. Thank you so much once more for the question, indeed, as well as your answer. And okay, so how long you can keep eggs and sperm in your bag?
Years and years and years. So the sperm and the eggs and even the embryos don't lose any quality for being frozen. So they can be there years and years. And actually, we have like samples that were used many years ago. Of course, we are not using them in this moment, but they are there. So luckily, the both the embryos, the eggs, and the sperm samples don't lose any quality, and they can be kept for years and years. There is no limit that way.
All right, and there is another follow-up from Tani, okay? On what temperature are they
Mhm.
frozen?
Well, normally it's minus 196 degrees, so quite cold there.
Okay, excellent. Thank you so much for this as well. Okay, there's just a comment. So thank you so much for this as well. Okay, and let's have a look. More questions are coming up. Let me go to the next one. When someone is included in the donor database, how is it selected, education, etc.? The question is, how is a woman incentivized, if at all, to become donor? What is it in it? What is it for her?
Actually, we did a research on that 2 years ago, and we asked our patients in that moment why they decided to donate. And the main reason is helping other women. So it was like the main reason why donors decide to donate. So some of them may have, infertility, well, some maybe friends or relatives that suffer from infertility in the past, and they are quite used to that kind of problems. And the main reason is helping other women to become a mother. So we are quite lucky in that way, because you know that, especially in the egg donors, if a patient has undergone a previous IVF treatment, they perfectly know what advanced stimulation and an egg retrieval means, and they are like very they are really nice people that decide to donate with us, and they don't mind to take some risks to try to help other women to become a mother. So in the end, like, they do like a great job, and in the end they let us help other women. If we didn't have our donors, it would be impossible to keep on doing so many treatments and helping so many people. So that's the main reason.
All right. Okay. Actually, there are some more questions in regards to donations. So, is there like a maximum number of donations per donor?
Yeah, exactly. The maximum number is 6 donation in our clinic, and the Spanish reproduction law let the donor donate until 6 pregnancies with 6 babies born at the same country. So it means that, for example, if the donor donates, let's say, 4 times, and there are in total 6 pregnancies in the same country, she won't donate anymore.
All right. Excellent. Thank you. And is it the same when it comes to sperm donor per country?
As I was in the last question, so I think that I mentioned it. So the maximum number of pregnancies is 6. So, for example, if the donor, it doesn't matter if it's an egg or a sperm donor, donates several times, but there are no pregnancies with that donations, we can keep on using that donor until 6 pregnancies are reached.
Excellent. Thank you so much for the clarification. And okay, I guess that is it when it comes to this kind of question. Sorry, there is like about sperm donor. Can I select the age, 21, 22, or even
Mhm.
less?
I'm afraid she can't. No, it's not possible. It's not possible. According to the Spanish reproduction law, the patient can't choose the donor. It doesn't matter the age or the height, the weight, so they can't choose any of the physical characteristics of the donor, even the age or well, whatever. It's not possible by law.
And thank you again for that. And in regards to the age limit, okay, so when you mentioned the age of 50, can the patient actually be 50, or they do have to have the procedure done before their 50th birthday or before they turn 51? Sorry.
Okay, so it depends on the patient. So we normally recommend before the patient is 50 years old, but in some specific occasions, on some specific patients, all the tests that we do and we perform to that kind of patients are fine. In very specific cases, we can try to do the treatment when she's like 50 years old and some months, but before 51 for sure, but it will depend on the tests and all the medical team opinions. So that kind of patients are discussed in our well, medical meeting that we have weekly, and we decide if we think that it's a good idea that if we could do the treatment in that kind of patients or not. So it's not just a medical decision. So you have to consider several and different opinions in the team, and of course the medical test that should be performed before making a decision. Of course, yeah.
And excellent. Again, thank you so much for that again question, and of course for your help. There are like three questions left at this point. And how important is the blood type match when choosing the donor?
I would say that is like the least important thing. The reason is that we know that there is no problem in choosing a different blood type donor. So it won't harm the baby, of course, and it won't cause any problem during the pregnancy. So what we try to do is, for example, if both patients are O positive, for example, the baby has to be O positive if they have a baby with their own eggs and sperm. So it's not possible to have a baby, for example, which is A positive. So in case the baby is A positive, it won't cause any problem for the baby, but it's impossible to have a baby with a blood type if you are zero. So we always try to match the blood type because many patients prefer not to say that they have undergone any kind of treatment, and they prefer not to tell anyone that the baby came from an egg donation or sperm donor treatment. So that's the reason why we match the blood type. It's different, for example, when both patients are a negative blood type, I mean A negative, O negative, whatever. So it's important to try to find a negative blood type donor to try to avoid any problem during the pregnancy. But in general, the blood type, of course, is important, but it's not the most important thing to consider. So, for example, imagine that we have like a perfect match donor, but the blood type is different from her. So we ask our patients and say, okay, we have a perfect donor for you, but maybe the blood type is different. So it won't cause any problem to the baby, and the patients can decide if they want to go on with that patient, if they with that donor, sorry, or if they prefer to wait until we have a, let's say, a different donor with the same blood type. So, well, it's not a very common situation because it's very unlikely to not to find a suitable donor regarding the blood type. But of course, in some specific situations, everything can happen.
All right. Again, excellent. Thank you so much for that. It's definitely important question. Lots of patients definitely wonder how exactly it works. So thanks a lot for that. If you can take a look at this, what is the birth success rate with donated eggs?
So the pregnancy rate, the implantation rate, depending on the treatment that the patient chooses, is around 65 to 68% in general. And depending on the age and the medical and previous conditions of the baby, the birth success rate may change. So it's not the same to get pregnant in the first attempt if you are, I don't know, 40 years old, than if you had previous miscarriages and you are around 50 years old. So the birth success rate may decrease. But in general, the implantation rate is around 65%.
And thank you for that once again as well. Next question, also some a question that comes up quite often: is there a higher success rate having a fresh transfer over frozen?
Well, actually, in this moment, both pregnancy rates are almost the same. So, in Clinica Tambre, the first embryo transfer normally is done with a fresh embryo, and then the other embryos are kept for the future. But in general, I would say that day by day, both pregnancy rates are really close one to each other. But nowadays, it's a slightly higher the pregnancy rate with fresh embryo transfer than with the frozen ones, but day by day it's going to be almost the same quite soon. So in general, there are not many differences between the fresh and the embryo transfers.
And again, thank you so much for that clarification. Next question is, I'm not sure if you can just have a look at it, of course. Can you recommend any clinic in Europe where you can choose non-anonymous donors? Do you cooperate with
Mm,
any of the clinics like this?
I'm afraid I can't.
Of
We
course,
can't
totally.
cooperate, and we don't. I'm not. Well, I don't know any clinic that you can choose. I know that in USA things are different. The nation is different in general, but I can't recommend any specific clinic. I'm sorry.
Yes, exactly. But of course, actually, someone also already wrote. Remember that we did have some webinars, for example, in Portugal or the UK.
Mhm.
You can go ahead on our site, My Advances. There will be some options available there, or you can email me, and I'll be more than happy to help you out and send you some links as well, so you can have a look. Okay. And I'm just checking because someone is typing, and so I just want to make sure whether it's another question, and if not, we will be slowly finishing. But Esther, already I would like to thank you for your presentation tonight, for answering all those questions. It's been quite a busy Q&A session back and forth, so huge thanks for that. And thank you also to everyone for joining us tonight, and of course for your interesting questions indeed. And before we finish, Esther, is there anything you would like to add?
I think that all is almost clear, and I would like to thank to you, Caroline, and to all the people that has joined to us today, and asking so many questions. I feel really happy because I think it's a really interesting topic, and I hope that all your questions have been clarified and answered, of course.
That's indeed the truth. So thank you so much for that. And it's always great to have you here. And I just want to mention to anyone, if you would like to also, you can reach me. I just put the email address right there in the chat section. So of course you can email me if you would like to get some more details for those that, for the person that asked about the non-anonymous donation. And we will be finishing for tonight. So again, thank you so much. Remember, it has been recorded, so you will have a chance to rewatch it. It will be available on myivfnces.com as always, and also on our YouTube channel. So I can only encourage you to subscribe. That way, you will know that the video has been uploaded. And I'm sorry, one more question just showed right here, so I guess we still can answer this, right?
Mhm.
So let's go to that. So how many times I need to travel to Spain for egg and sperm donation?
Well, actually, we recommend coming for a first consultation to take advantage and do all the tests that could be needed. Many patients prefer to do all the tests there and just come to do the embryo transfer. So I would say that just once or twice, not more.
All right, so once or twice would be good enough then. Thank you so much for that. And as you can see, there is a thank you from
You're
Tani
welcome.
for answering that question. And of course, there are some thank yous coming up right here as well. Okay, again, someone is typing, so just okay, yeah, there's a thank you for the presentation for you, Esther, right here.
You're
So
welcome.
once again, huge thanks for all the questions and of course for joining us over and over again. As you know, we will be back here tomorrow again at 8 p.m. UK time. And Dr. Esther, it's been a pleasure again to have you back. And I do hope this is just another of our webinars. So I'm already looking forward to the next one. Thank you, everyone. Take care. Have a lovely evening or day, wherever you are, and hope to see you tomorrow as well. Thank you.
Thank you.
Bye.
Bye bye.